Councillor Keith Eglai, Chair, Ottawa Board of Health, conseiller municipal et président de Conseil de santé d'Ottawa, and Councillor Jenna Sudds, Chair, Community and Protective Services Committee, conseillère et présidente du Comité des services communautaires et de protection. Members of the media are encouraged to refer to the email sent by the Media Relations Team for a fulsome list of spokespeople phoning in. Pour une liste complète des porte-paroles au téléphone, prière de consulter la liste envoyée par courriel au nom de l'équipe des relations avec les médias. I will now invite each agency alphabetically to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. We'll now start with 1310 News, Jason White.
Thank you. My question is with regards to city-run childcare centers. I heard during the council meeting that they're estimated to reopen by mid-July. I'm wondering if someone could expand a bit more on explaining the gap between the province giving the all-clear for childcare centers to start reopening by this Friday and why it's estimated that the city-run childcare centers may not open until mid-July.
May I ask Donna, I think you're on the line. Would you like to take that question? Because we were just discussing that the other day.
Yes, thank you, Steve. So we are planning on opening in mid-July, and the difference is the gap is related to what the guidelines tell us in terms of the requirements to deliver care. And those guidelines that we got last night at the kind of the highest provincial level. And in the guidelines, there is direction for us to work with Ottawa Public Health to really look at how those guidelines will be implemented in the local context. So there's still some work to do around those guidelines. Although they're similar to the emergency care, there are some, at first blush, some differences that we need to work through. And as well, emergency childcare is closing on June 26th. And there are some dependencies on both staffing and facilities that those be closed in order for us to redirect our resources in those facilities to expanding the childcare. And we also need to bring back our staff. So as a result of the pandemic, we put a number of our staff on emergency leave. We need to bring them back and train them on the new protocols. And we're anticipating that some of the guidelines that are different than emergency care will change some of the modifications in our facilities. And there is also some extensive requirements in terms of infection control and some disinfection and cleaning of both the facility, but then all the toys and material that needs to be done as soon as we're about to open. So for the municipal childcare, those are the components that need to be in place in order for us to be able to open. So there's lots of dependencies. We'll try to expedite that as quickly as possible, but it will depend on how quickly those other components come into play.
Thank you. My follow-up question is about the ball diamonds and sports fields reopening possibly mid-June. I'm wondering if it's expected that will create more challenges or more pressure on bylaw in terms of enforcing the remaining COVID-19 restrictions or on those parks ambassadors to communicate that, yes, some things are allowed now, but not everything. I'm wondering if someone could address the challenges or pressure that could result of reopening these ball diamonds, but with certain conditions for practice only, et cetera.
Thank you. No, we believe that we're going to continue with our current practice. Both the ambassadors and the bylaw officers will continue to encourage people to physical distance and follow the rules that will be set in place as this gets rolled out. And our colleagues in Parks and Rec, as they inform groups about the ball diamonds being open. So we don't think it's going to be a big drain there. It'll just be the continuity of now we're getting back to some semblance of new normal.
Thank you very much. Do we have someone from CBC Ottawa on the line?
Yeah, sorry, I just got on because I didn't have the number. I apologize if I am going to be replacing repeating something someone else has asked a bit about. I was wondering if you could talk about again, I'm sorry if Josh has already said this, a little bit about the confusion that's happening. So one of the slides says that, the playgrounds will be open. There's a little bit of disconnect, I think, between what's opening Friday, what's not opening Friday. I think one of the slides says, like, playgrounds will be open, but that doesn't seem to be the case. So can someone just sort of talk a little bit about what we're going to be seeing Friday and what's going to be a little bit farther off into the future? Thanks.
Dan, are you on the line? You can take that one.
Yeah, I am, Steve. So what you will see opening is all areas of the park, essentially. What isn't open yet are the actual play structures, and it is probably the number one item that we're getting asked about at this point. But the province has specifically exempted play equipment in parks from reopening. So essentially, those are the only things in the playgrounds and the parks that are not available for use just yet. We suspect that will be in the next phase.
Okay, and also I'd ask Dr. Etchis or somebody from Ottawa Public Health, since the protests on last Friday, have you seen any increase in testing numbers? Are you concerned about between the protest Friday and as things are opening up, the number of cases going up? I was wondering if somebody could address that as well.
Yes, thank you for your question. Ottawa Public Health has not seen a rise in cases related to the march. We know that the incubation period can be up to, say, 14 days, so we continue to, make sure that we're exploring that as we interview people who are coming forward and testing positive. We will communicate to the public if we find any cases related to the march so that everyone who participated can be informed and take precautions. I am very encouraged that people who participated in the march did wear masks for the most part, and that demonstrates to me that people were not only concerned about anti-Black racism, but also about COVID-19, and that the efforts to wear a mask were significant, and I expect that people who develop symptoms will also do the right thing to protect others and present for testing. Our testing numbers remain solid. The assessment center and care clinics are busy. People are coming forward to be tested.
Thank you very much. Moving on, we will go to Josh Pringle at CTV Ottawa.
Hi, it's Ted Raymond from CTV filling in for Josh. Josh is off now, but I will ask the question if that's okay.
Yes,
so
that's
question,
fine.
Thank you. So my question is just in April, the city had announced temporary layoffs of about 4,000 part-time employees. I guess this is for Mr. Kanellakis. What is the status of those employees today, and how many do you expect will be coming back over the next several days and weeks as you start to reopen?
Thank you for your question. It was 4,200 employees that were put on emergency leave. Temporary emergency leave was the status. So we are now assessing how many are going to have to come back. Mr. Chenry is probably going to be where we predominantly bring people back to open up the camps, the pools, and all the other things, the programs that are going to start running, even though at a reduced rate. And as far as the rest of the organization, when libraries was also impacted, when they can finally open, they'll be able to bring back some of theirs, I'm assuming. But I don't have a specific number right now. We're still assessing that over the next 2 weeks to see how many people we're going to have to recall from the temporary emergency leave. Dan, do you have a number in terms of your immediate needs that are going to be recalled back for culture and recreation?
There's no precise need yet. It is probably in the area of several hundred employees across the city, but we don't have a firm number yet.
Okay, thank you. My second question is just with regard to the finances. I know that there will be a report coming to the next city council, but I'm just curious if it's possible, given the enormous impact the pandemic has had on the city's bottom line, will there be a need to increase property taxes beyond 3% in the next budget? Is that something that's being considered by city staff?
Yeah, the short answer is no. We know that we need financial assistance, as I mentioned today, from the federal and provincial governments to help us through these extraordinary times. But there'll be a healthy debate in terms of how we go about that, because obviously to some people 3% is too much because they've suffered as a result of loss of job. To others, it's not enough because they want to see increased programming and activities that the city is involved with. So, the commitment I made in the campaign was to keep the tax rate at 3%. And I believe that's reasonable, given the fact that if it was to go lower, we'd have to make cuts, significant cuts. And if it goes higher, then that has an adverse effect on those people who are just getting by as a result of the ravages of COVID-19 and what it's done to people's health and also to their economic situation. Thank you.
Okay, thank you very much.
Thank you. We will now go to Craig Lord at Global News.
Hi, this is a question for Mayor Watson. You mentioned in some of your comments at Council that eliminating racism will not fall to one council member. I'm wondering, what will you be doing as mayor and the leader of council to combat systemic racism in Ottawa?
Well, a couple of things. I think obviously support Councillor King in his efforts, because as I mentioned, it shouldn't just fall on one person's shoulders. It's a collective responsibility. So I'll be working with him as he prepares his strategy for the new person who will be hired. My hope is within the next several weeks to head up the Secretariat. Secondly, obviously, as a member of the Police Services Board, to work with the Chief in terms of initiatives that he wants to bring forward and get implemented to ensure that we're combating racism both inside police headquarters to those people who, who are taking part in racist behavior. It's not by any means the majority of the men and women who serve in uniform. I'm very proud of their work, but there are obviously some challenges, and we've seen those come to light over the course of the last couple of months. So, we'll work as best as we can to ensure that there are necessary financial resources to run, for instance, something I know Councillor King is interested in, an aggressive education and advocacy campaign that we work with the schools and the school boards to ensure that our own employees here understand the severity of engaging in racist activities, even if it's just sending an email that contains a reference or something in a derogatory fashion. Those kinds of things have to be stopped. And, as mayor of the organization, working with the city manager, Steve Kanalakis, we have an obligation to ensure that we practice what we preach, and we make sure that people who are engaged in inappropriate and vulgar racist activities are dealt with, and no longer call the City of Ottawa their employer.
Yeah, and just as a quick follow-up to that, we had Councillor King say or ask staff to bring forward some potential reforms for policing in Ottawa. Are there any particular reforms that you're a fan of, be it body cameras or reallocating funding from the police? Are there any of those proposals in particular that you want to see considered going forward?
I don't want to prejudge what the Chief is going to do. Obviously, first and foremost, we're very glad with the Chief's statement that he made that he's not going to be applying for the Toronto job. We're very happy that he's going to stay here with his family, and I think he's enjoying the challenge of working and heading up the Ottawa Police Service, and we're very pleased with his performance. I think it's best because those areas of responsibility fall under the Police Board and not City Council. We work with the Chief to bring forward any recommendations that he has. Every budget dealing with the police is a challenge, obviously. We have a commitment that Council has made unanimously to increase, for instance, the number of officers. That is a challenge in the midst of COVID-19, and we're working with the police to determine how we bring those additional officers online.
Thanks very much.
Thank you, Craig. Nous allons maintenant aller à Julien Paquet.
I'm going to go to Julien Paquet from Le Droit. Julien Paquet from Le Droit. Dr. H.S., you mentioned during the council meeting today that it's important to reiterate that people should limit the contact they have with other people. Well, basically between family groups. Now, do you think that the lifting of the lockdown will lead to a situation where people are less careful at that level? Thank you for the question. Well, it's important to continue to limit the number of contacts you have with other people, because the more contacts you have, the more opportunity there is for the spread of the virus. Well, I think that people in Ottawa can actually do activities in different ways. I have confidence in people in this city because it's their actions since the start of the pandemic that's led to the success we see today. And I think it's important to continue to repeat the message, to hammer it home over the coming days and weeks. People will need to go about their daily lives while observing physical distancing, and they'll perhaps be encouraged to wear a mask if it's difficult to keep the 2-meter distance. We'll see, of course. We will be conducting oversight and we'll be looking at the data, but I think it's important to exercise social distancing and people understand that. Now, in contact tracing, is this difficult? Is it being made even more complicated because of the reopening of the economy? Workplaces are opening up again, businesses are. Is that complicating your job? Well, each time we have a positive result where we find someone is actually infected, we do a follow-up. We ask for a list of things that this person has been doing, and we use that list to determine the contacts. Now, given that workplaces are opening up again and services are opening up, well, it's quite possible that that list will be longer. It's quite possible that that contacts go up as well. But if people respect the 2-meter rule, they can actually have more contacts. That's the idea, I think.
Merci beaucoup, Julien.
Thank you very much, Julien. Sue Sharing of City from the Burbs.
Mayor Watson, I know that there has not been, there hasn't been a lot of research into this idea, but I'm just wondering at first blush, what do you think of the idea of having more city staff working at home, and what benefits do you see that could stem from that?
Yeah, I think it's an interesting proposition. One of the things we're trying to do, Sue, is to also encourage our largest employer, the federal government, through discussions that Steve Kanalakis is having with Treasury Board, to see if individuals in the federal public service who are working from home now, if that's working out well for them, if that can continue, because that takes a lot of pressure, obviously, off our transit system as well as our roads. I think there will be, I don't want to speak for the administration, but I think there'll obviously be some consideration given to some people who can work effectively at home to make sure that they're doing a full day's worth of work for the taxpayers of Ottawa. And if that also helps with our, rush hour periods to spread out some of the challenges we have in that peak period, usually between, quarter to 8 and 8:30, then we should look at it and keep an open mind. But, a lot of our employees obviously need to be here, the counter service for Service Ottawa, the people that need to have contact with individual residents or groups or businesses and so on. So, I think this has been, one of the good things, one of the few good things that's come out of COVID-19 is it allowed us to, in essence, test, on a pilot basis, how people are working and how effective it is working from home versus coming into the office. And I think the other thing is, obviously, we don't want to bring everyone back at once, and that is going to cause challenges, and we don't want to see another spike in COVID-19. So we have some a lot of work to do. And the city manager briefed us a little while ago talking about, the physical restructuring of cubicles and offices and so on. So that's going to, be a challenge both physically and financially for the city. And some of that may be eased by the fact that we have some of our employees who are able to work and wanting to work from home. Thank you.
Thanks a lot. My second question is for Dr. Etches. And I know that there's not a simple answer to this question, but one of the things that I'm sure you hear and I know I hear is that there are a lot of different messages out there about what you should and you shouldn't do. Is there any way, is there a solution to this? Is there anything, I don't want to, I hate to even bring up the demo because I absolutely believe people felt they needed to go there, and I'm proud of those that did, but people don't understand why you can do one thing and not the other. Is there a solution to this, or is there something you can do with the province to make the message clearer?
I'll tell you, it is the reality that it's hard for us to keep track and people in the population of what's changing, what's allowed, what's not allowed, and it's going to continue to change. So what I find as a really solid place to go back to, something that isn't changing, is a public health advice about how to stop transmission of this virus. It's the same as it's always been. And we're introducing a slogan to help people understand too. I don't think I even said the slogan at council, so I'll say it now. We would like people to be COVID wise. So COVID wise, W-I-S-E, means wear a mask when you're within 2 meters of someone else, for the W. For the I, isolate yourself if you're sick, if you have symptoms of illness. That will really help us make sure that you don't infect others, and go and get tested if you have the symptoms of illness. For the S, stay 2 meters away from others. Even as you go back to work, if you go to one of these activities that's now permitted, stay 2 meters away from others as much as you can. And the E is a little bit of a stretch, but we're saying exercise good hand hygiene. So keep your hands clean. Use hand sanitizer if you aren't able to wash your hands. So COVID-wise is what I suggest we go back to. It's about those activities that have not changed that will decrease transmission of COVID-19 in our community. It does work to prevent infection, and that's something then people can take to go forward and make their own judgments about particular activities. So, people need to think about their own risk to their health. Are they over 70? Do they live in a household with someone who has chronic disease? Everyone's going to have different factors that affect their risk for serious illness, but you can use these principles to decide. And the other things, the principles that don't change are about the size of the gathering affects the risk. So the bigger the gathering, the more risk. So again, keep your contacts to as few as possible. Even as you go out and you think about the groups of 10, less is better still. So make those judgments in an informed way. I think that's helpful to think about what isn't changing.
Thanks a lot.
Thank you. Moving on, we will go to John Willing at the Ottawa Citizen.
Hi, Dr. Etches.
You've got a good barber right here.
Be on public health inspections, especially when it comes to food service premises, personal services, childcare. Do you find that your inspectors are going to have to go out more into the field to inspect these places, and what's the demand going to be like?
Yes, so Ottawa Public Health's inspectors have a responsibility around food premises, but we have confirmed with the province that the usual reopening inspections don't need to be in place necessarily on the same kind of sort of timeline as what we had done previously when businesses would open for the first time. The priority is going to be on the pools and the pool inspections so that people can get access to those, because we want people to be able to cool down in the summer. So we have a contingency planning around bolstering those teams that do the inspections right now at this time to help businesses get up and going. And, these are the same inspectors that were working on outbreaks in long-term care homes. So we are doing a little bit of moving people around internally in the Ottawa Public Health team, but I appreciate everyone's flexibility and understanding that right now it's important for businesses to get up and running.
Thanks, Doctor. I think my second question might be for Donna Gray. It has to do with daycare's opening now. And I know the city has been running just a handful of emergency daycare centers. And I'm wondering, Donna, if you could tell us what your impression has been the city trying to run these daycare centers under the public health concerns and trying to implement some of the measures to reduce transmission of the virus.
Thanks, John. So, we have been operating 3 emergency childcare centers, and then just have recently worked with the community to open childcare centers. And I think some of the first, challenges have been around staffing schedules and being able to ensure that our staffing are in place, particularly around emergency childcare, because there were different hours of care for us. So we had to really think about how do we ensure that we have full staffing, but also have the capability, if in fact there's an infection, what to do in that situation. The infection control practices just to continue to keep the facility COVID-free and to ensure that the kids and families are protected. So there's fairly rigorous practices that have to be put in place. So there's a big element in startup and just getting people trained and understanding that. Now, the child care centers, are typically used to infection control. It's just the rigor with which we would need to do that and the different types of processes that would need to be in place. As well, they've had to adapt areas like how they put kids down to sleep, sleeping patterns, how they cohort, and how they are able to keep small groups of people and then not transition staff from one cohort to another. So a lot of it is around the logistics of the planning and making sure that your staff are free from infection, from your screening, et cetera, in terms of people coming into the facility, and then your practices in the facility in terms of keeping those cohorts so that there is not cross-contamination between different groups of kids with staff. So again, most of it is logistics. So as we move into, and I think this is an important piece to make, when we think about childcare and childcare opening is not kind of full opening. It's opening still understanding that we have more precautions that need to be in place than opening a regular childcare as business as usual. So really these new practices or the new guidelines that are coming in are going to continue to restrict how many kids we can actually have in any particular daycare center because the number of staff requirements to children. So again, we're going to have to readapt and rethink those logistics again in terms of this next phase of opening, and then understand what those modifications are going to need to be in our facilities, both in the physical location as well in terms of some of the structures as we move forward.
Thanks, Donna. Thanks, Kina.
Thank you. We will now go to Taylor Blewett at Ottawa Sun.
Hi, my first question is for Dr. Etches. Looking at the new data dashboard that launched today, showing the local case numbers and information, I noticed what looked like a decline in the overall number of deaths and number of cases between what it was yesterday and what it was today, and I was wondering if there's an explanation to that.
Yes, my understanding is that there were maybe 7 or so cases that were not actually people who resided in Ottawa. And the way cases are counted, we do it based on residence. So those cases have now been attributed to a different health unit.
Okay, awesome. And my second question is, I see two of, I guess, the deadliest outbreaks in long-term care homes in Ottawa, so at Montfort and at Madonna Care Community, they're now declared over. So I'm just wondering if you can speak to how the homes and the community partners that were helping out there were able to get to that point, what it actually means that it's declared over, and why it did take about 3 months to declare the pandemic, to declare the outbreaks over at those facilities.
We all look forward to declaring the pandemic over, I can tell you that. So the technical definition of the end of an outbreak comes 14 days after the last case had, and that is accomplished by making sure there's no ongoing transmission. And so the different steps that are most important are to make sure that people who are positive are isolated, and that people who are interacting with people who might be positive are wearing the proper, protection in terms of whether it's gowns or masks or face gloves when providing care, and in an outbreak situation, treating everyone in the home as if that person that they're interacting with could also be a source of infection. So it's really about universally also applying precautions in interactions across the home. So it takes training, of employees to carry out these infection prevention and control practices. It takes monitoring to make sure that people are getting it right. It takes enough of a staff complement to be able to make sure people have the time to provide the care without being rushed or running into trouble. So there are a lot of different factors that really all together, it made a difference when the homes were able to have help from hospitals to increase their staffing numbers, to bring in more of that training and equipment. And we've also undergone the testing of residents that has enabled a little bit more cohorting to understand where infections are in the homes and keep people who tested positive apart from those who tested negative. There are many factors, but it is good news that the homes have been able to bring the transmission to a halt.
Thank you. Nous allons maintenant passer à Stéphane.
We'll now go on to Stéphane Leclerc from Radio-Canada. Hello. My question is for the Mayor, first of all, Mayor Watson. You expressed concerns about the scooter pilot project. Some people are worried about this, especially people with disabilities. Now, in the pilot project, is there anything that was enough to actually allow you to support that project? Well, Stefan, it's only a pilot project. It's over the period of a couple of months during the summer and the fall. If we identify issues with the scooters on the sidewalks, if there are issues for people with disabilities, well, quite probably we will not sign a new agreement for next year. That's the reason I supported it with some reluctance, of course, is because it's a pilot project over a specific time period. There are restrictions and there are rules governing the supplier. So I think it's important to listen to the public, and that's how we'll decide whether it's the right initiative for residents and visitors to Ottawa or not. Thank you. My next question is for Dr. Etches. Daycares will be opening up on Friday. We've talked to many daycare operators, and they're all saying that 3 days is not enough to get ready for reopening. It's not enough time for them to actually meet the requirements that are being made of them in terms of people's safety. Well, I'm sure that it will take a lot of lot more time for some daycares to actually comply with the standards. They don't have to open on Friday. That's not compulsory, but as Donna Gray has said, it's an issue of preparation, I think, and Ottawa Public Health is here to help. There's also the provincial advisory as well. That's important. So you're not really very concerned about this. Well, I think that businesses want to do the right thing to protect their employees and to protect the kids as well in the daycares. So I would imagine that there are many daycares who will wait to reopen. They'll wait to have the proper procedures in place before they reopen, I think. Thank you very much for that. You're welcome. Thank you.
To Pat Igocioni, your community voice.
Yes, my first question was for Dan Chenier, if he's still on the line.
Yeah, I'm still here, Pat.
Yeah, Dan, normally there's sorry, I'll start over. Sorry, I think I heard you correctly earlier say that the camps and programs and whatnot, there'll be fewer of them and fewer in them. I'm just wondering, with the pent-up demand out there, if you're concerned at all about with only online registration, that system crashing as it has in the past.
We're not terribly worried about the system crashing. Over the last couple of years, our IT group and our provider for this software have done significant work to make it stable. The capacity, the number of people that can be served at one time, remains a challenge, and so we're not worried about a crash, but we are worried that the usual channels of front counter are not available, and especially for people who have relied on that channel, which is an important one in some communities. With the buildings closed, we simply are not able to meet that need right now.
Thank you. My next question was for Councillor Hooley, the chair of the Transit Commission. No secret, it's been a difficult year for OC Transpo, but how satisfying was it to get that agreement with ATU today?
It was fantastic. It's historic in the sense that it's a 5-year. We had to do the first ever virtual in-camera meetings and everything to get it done. But my appreciation goes to the team led by David White and John Manconi that were able to reach an agreement with ATU for 5 years, and it protects the taxpayers, supports our ridership, and recognizes the great work of our employees.
Thank you.
Thank you.
Thank you very much, everyone. This is all the time that we have. C'est tout le temps que nous disposons aujourd'hui.
That's all the time we have today. Have a great day.
Still now, everything is alive. At last, I knew I must see through the eye of the totem itself, the mythic eye of the forest.
Seldom able to live by her brush, before she died in 1945, Emily Carr was in the first rank of Canadian painters.
This is my country.
Je les adapterais pour faire quelque chose avec les aînés. Bon, c'est sûr que dans un contexte d'une équipe de travail, c'est un peu différent. Donc, au début, on a les préparations, les réchauffements, les exercices de rire, puis après, on fait des séries d'exercices de yoga du rire. Puis là, ils sont divisés.